Hey, welcome to the show, the go-to show, your go-to show for all things health. Hey, Aiden. I'm Jonathan Fisher.
I'm Aiden Seraphim.
All right. So today, what would you say? We're going to talk a lot about functional medicine, but really about the problems inherent in healthcare. Quote, healthcare. How would you define it?
Well, I think that we are in a really interesting, precarious position right now because our healthcare system is actually a disease management or mitigation system. And it is on a downward trend towards, I believe, eventually failing and collapsing. So we need to have this conversation.
Yes. Lives could be saved.
Including
Seriously.
yours.
And the life that could be saved might be your own. So how we're going to do it is we literally Googled, I'm guessing you used Google or some sort of search engine, a bunch of facts about things like functional medicine. And so Aiden's going to read a bunch of things off, literally read them because we want the information, the facts, the statistics to be accurate, and then we'll talk about them and just kind of go from there, right?
Well, actually, I want to start by sort of describing some of the primary tenets of functional medicine, and interestingly enough, how they actually really correlate with Chinese medicine principles as well, because I am an acupuncturist.
And I don't know as much about Chinese medicine.
And then the statistics that I'll be reading off are actually healthcare statistics about chronic disease and how our current healthcare system is not really addressing this chronic disease issue. So
perfect.
All right, so functional medicine, the three areas that I felt were most similar to Chinese medicine were the idea or the thought and the belief that we're looking at and addressing each human being as a completely unique set of genetic, biochemical markers and life experience, that has led up to whatever their current situation is, So we're looking at that whole person and not at a disease itself. So that is really, really important because there are a lot of different reasons that somebody might end up with heart disease, and they could all be really very different from one another, which means that our approach to treating them needs to be really different for each person. Yep. So that's the first one. The second one is this idea of asking what is causing a person to be in a state of imbalance or disease in the first place. So that's, like we talked about last week, the importance of getting to the root causes of imbalance or malfunctioning of the system. And so we find what is not functioning, and then we figure out how can we bring the body into a better state of functioning again. And then the last one was seeing the body as an integrative system, which means that all of our organs have a relationship with one another, and they work as a whole with one another. So instead of breaking everything out into specialized, you go see a cardiologist or a, nephrologist or a neurologist, you realize that, maybe somebody's heart disease is coming from their kidneys and not really their heart to begin with, so just really approaching it as a whole.
I've actually had a cardiac electrophysiologist, and yes, there actually is that. I was talking with him, and I said, really, we started really talking about the healthcare system, and he said, well, to be honest, we all think that it starts in our own little area. With the whole idea of if you have a hammer, everything looks like a nail, where you really have to broaden out the search. And in my thinking, if somebody's a doctor, if somebody's a Western medical doctor and they're doing something in functional medicine, to me it's more fun. Because it's like, I see this and then it's this. I see that and it's that. Instead of really getting in there and to me it's more creative, it's more fun, and obviously it's more beneficial to the client, to the patient, to do that. So Cool.
Well, and what's so important about this and what makes it so relevant to us is that, 85% of what, goes into determining if we get a disease is, things that we actually can manage and have control over. That has to do with like diet, lifestyle, like stress management, et cetera, et cetera.
Perfect. All right, what else do you have?
All right, so let's start from the beginning. So I think it's also important to mention that, in the beginning, I'm not saying that Western medicine is, like bad, and that, functional medicine is the go-to thing for every single thing on the planet. I'm saying that, Western medicine started off, dealing with really life-threatening, illnesses and stuff. In the 1900s, the 3 leading causes of death were infectious disease. And so it was really focused on that, and like the issue is that today it still is really focused on like very acute life-threatening diseases, and it's not set up to deal with chronic disease.
And should we talk about what that is, the difference?
Yes.
Let's do it right now.
Go.
So acute disease, and it's so tempting when I say that to name a disease that I think is adorable, but acute just means life-threatening. Think of an acute disease as something that you would call an ambulance for, something that if you don't get this thing treated, you could die. An acute disease. So things like you have an accident, even things like a stroke or a heart attack, something that might become a chronic or a more longer term thing. If you're actually having a stroke, you're actually in the middle of a heart attack, it's an acute disease. Any kind of accident, breaking your arm, any kind of like car accident, an acute disease. We talked about a ruptured appendix, emergency medicine, acute diseases. Calling an ambulance, Western medicine is the best source for that. I mean, everyone would agree with that. What else would you add under acute issues?
Just infectious diseases. Your favorite
infection.
One, which is?
What was my favorite one?
The cute one?
Well, yeah, mumps, because mumps are cute. It is my favorite acute disease is mumps. Actually, when I didn't have the mumps, but when I was 6 and I was in the hospital for 7 weeks, it's funny, like all the heart surgeries and the brain surgery and the stroke, the least sexy one is my subacute bacterial endocarditis, which I had when I was 6, an infectious disease.
Right. And
this is something where if it weren't for the medications that I was given for, I was supposed to be treated with penicillin, but I'm allergic to that. So they had to come up with a new way to treat it. So these antibiotics, which was one of the things that we use in acute care that allopathic Western medicine does so well, saved my life. Right. And one thing we want to talk about is when we're talking about functional medicine or what you might label alternative medical practices, clearly we're not saying that Western medicine is bad. I would not be around if it weren't for Western allopathic medicine. It's broaden our idea, broaden our scope, and incorporate as many of these different things as possible, which we talked about, I think, last time as well.
Well, and also the threats that we were dealing with when, Western medicine first established itself are no longer that threatening to us anymore. Yeah. And now what is actually very threatening to us is this really uprising trend of chronic illness and disease. And so I'll start with the first statistic.
Right. Is
that chronic diseases are the leading cause of death and disability in the U.S. 133 million Americans, which is 45% of the population, has at least one chronic disease.
So what would be some chronic diseases, giving examples of those?
So these would be like diabetes, heart disease, cancer, MS, these...
Parkinson's, arthritis, degenerative diseases that you think are associated with getting older. I would put in there Alzheimer's, different types of dementia, things that we think are due to aging, but not all populations get these diseases. So more like Western diseases.
Allergies, IBS, even anxiety, depression, like
pain, chronic pain.
That's like
Clearly.
number one,
I know.
actually.
The biggest thing that, Yeah, pain is obviously headaches, back pain. The list goes on. Things that you might be prescribed a medication for if you're going to Western medicine, that they never say there's a time limit. I've asked them. I was put on blood pressure medication as an example of sort of the blending of the two, of East and West, and I guess functional medicine, is when I was, I think, 16 or 17, I was put on blood pressure medication. And what else would they have done? Because I wasn't overweight. I was exercising 3 or 4 times a week. In fact, I was quite fit, eating healthy, didn't smoke, didn't do any drugs. I'm 16 or 17, so how bad was my stress? So what are you going to tell a kid who has high blood pressure when he's 16 or 17 to do lifestyle-wise? Now, the difference was, for me, they kind of were going for cause, which was born with structural issues in my heart. And so I'm on this medication. But the thing about the medication is they never said about how long to be on it, because they assumed, the rest of your life. And longitudinally, there's no data for this. And in fact, I asked them when I went to college and I knew what longitudinal was. I didn't know. I said, so like longitudinally, because then they respect you more. I go, how long, what are the studies for people who have been on this for decades? And my doctor's like, we don't have them, because most people get, although it's changing now, unfortunately, which is why it's so critical, as you're saying, it's going down, that people are getting obese, people are getting diabetes earlier, people are having high blood pressure younger, like me. And so we're starting to see what it would be like to be on these drugs for decades, because as we'll talk about, all drugs have negative side effects. And it's, is the positive better than the negative? And you have to decide those things. So
well, and as I mentioned in the beginning, the whole thing about a functional medicine approach is that we recognize that each person has a unique set of circumstances that have led up to what's going on with them. So for you, it was a structural heart anomaly that you were born with, right? For others, it could be that they were, in an environment that was super traumatic for them. So they have chronic anxiety that over a long period of time has raised their blood pressure, right? So that could be one. It could be people who are, really nutritionally deficient in certain, vitamins and minerals and stuff. And so that has led over a long period of time to heart disease, improper diet, people.
So many things,
I mean, we could go on and on and on. So that's why we need to have a lot of different options, but these options need to work with one another and respect the strengths of one another.
Perfect. What else you got? Let's get more facts.
So chronic diseases are responsible for 7 out of every 10 deaths in the U.S., killing more than 1.7 million Americans every year.
Wow.
So it's a pretty serious problem.
That's crazy.
And right now, in our current healthcare system, we're really not set up to deal with these type of diseases. And so like you said, you go to a doctor and you have diabetes. They'll, give you some lifestyle modification sort of suggestions. I think they are actually starting to do that now. But then, they'll give you medications that, sort of help deal with some of the side effects of having, that. But those medications, like you said, cause more side effects and more side effects. So it's just symptom suppression and management. And so you never actually address the diabetes itself. And so as we go along, I actually have sort of some very disturbing and interesting statistics.
Oh, I love the disturbing. Itself. Keep going. What else do we have?
All right. Well, here we go.
Yeah.
Chronic diseases can be debilitating. For example, did you know that every 30 seconds a lower limb is amputated as a consequence of diabetes?
I would hate to be that guy. Oh, you mean in general a limb is?
Yes.
Because if it was just one person, that would be an awful
every
existence, right? A little bit more. Poor guy.
Oh my gosh.
That's crazy, really.
Yes. And what's even more interesting is that there was a statement that was given by the CDC that said, and I will also read this, that by eliminating 3 of these risk factors for chronic disease, poor diet, inactivity, and smoking, it would prevent 80% of type 2 diabetes.
Wow.
So just by changing 3 behaviors, you could prevent 80% of that. But instead of spending the time and energy and resources and money on education and that process, we are spending it on something that's just basically going down the toilet because people continue to get sicker and sicker and their limbs get cut off.
Well, if that isn't motivation enough, I don't know what is.
This sounds very
Do you want your limbs cut off? Do you? All right, what else do you have?
People with chronic diseases are most frequent users of healthcare in the U.S. So 81% of hospital admissions, 76% of physicians' visits, and 91% of prescription-filled medications are for people with chronic disease, illnesses.
Wow.
So we're spending an enormous amount of money on this problem, and it's actually not getting us anywhere. And there was something, so there's a guy, Chris Kresser, he talks a lot about the importance of functional medicine and moving to a different paradigm. He actually has a book called Unconventional Medicine, Join the Revolution to Reinvent Healthcare, if you're interested
How do you
in this
spell his
topic
last
at all.
name?
Kresser, Chris Kresser. If you're interested in learning more about functional medicine and things that you can do to start changing some of your current behaviors, maybe?
Sure.
Then
beliefs.
I would suggest checking out his book. But anyways,
Perfect.
he said in a podcast one time that, you know, the argument a lot of times I think against, you know, making changes is that it's financially not feasible. You know, and there's this really weird thought that, you know, functional medicine is going to cost more than conventional medicine.
Yeah.
However, he made this example of how it costs about $15,000 a year to take care of somebody who has type 2 diabetes. But if you took just a fraction of that, say like you just took $1,000 of that and paid for that person to have diet and nutrition coaching and, you know, physical fitness training and started getting them sort of like set up on a routine and stuff,
Right.
that over the course, so that's $1,000 investment.
Yep. As opposed to 15.
As opposed to 15 a year. So if you did that, you could, in a sense, prevent that person from even getting type 2 diabetes. And then over the course of their life, you would be saving $500,000 in treatment for that person.
Okay.
So even if I made
crazy.
the number a little bit higher and said $5,000 in,
Yeah.
you know, like lifestyle management and, you know, nutrition,
Right.
you know, counseling, still, you're saving $5,000 opposed to $500,000 over the course of that person's life.
And think about this. So first of all, so type 2 is like insulin resistant diabetes. Usually you get it when you're older, although that is also changing when you're like getting overweight and whatever. But think about the thing that I brought this up when we were talking about it before, where not only are you not taking the insulin or doing whatever, but imagine the life that you're now able to lead. Because you've saved all that money. Conservatively, you've saved a lot of money, but now you're possibly thinner, certainly more athletic, more physically capable, living a wholly different life, all these other things that are positively being affected, and you're saving huge amounts of money. I mean, to me, it's like you could pay all that money and what you're getting lifestyle-wise, happiness-wise,
Right?
It tips the scale.
For me, it's like you're allowing somebody to actually have vitality and energy again. And when we have vitality and are connected to our own, you know, energy source and force, then we are able to bring forth that part of ourselves that we're meant to share, you know, so they not only will feel better, I don't know, maybe look better if they want to. I don't really think, anyways, that's a whole nother topic. But
a lot of topics. Oh, so what else do you have? So we want to do a couple more topics. That we have the takeaways for you.
Here we go. So chronic disease accounts for the vast majority of healthcare spending. Total amount spent on public and private healthcare accounted to approximately $2 trillion in 2005. More than 75% of that went towards treatment of chronic disease.
Wow. Okay.
So, I mean, one of the issues that we're having, though, is that we have to begin moving more towards an integrated treatment model, because at this point right now, doctors only have about 10 or 12 minutes with a patient.
Right.
And in that amount of time, you don't have enough time to, you know, interview them and determine and, you know, ask the the questions that are needed to determine what is the root cause of
Get to
their
know the
thoughts.
patient other than the stats and the little figures and the readouts and whatever from the test they've taken. You don't know them. You can't ask those questions.
And even if you do discover what the root cause is, you don't have enough time to begin to coach and train them
Yep.
in changing their behaviors, which is why you need a team,
Yep.
why you need a nutritionist, why you need a fitness expert, why you need like a chiropractor or an acupuncturist or a hypno coach.
A hypno coach. All right.
I think
All right.
that was all of my statistics.
Cool. Well, we're pretty much at the end here. We want to. One thing we'll want to say is, like, when we're talking about these different things, and we'll maybe throw this idea or that idea, or we'll say a sentence or two about this thing. If something grabs your attention, like, hey, I'd like to learn more about that. That's what the comments are for. So put it in the comments, like, hey, maybe you should do a whole show or several shows on this topic or that idea or that one thing you said or what is that thing you said. We'll explain these things in greater detail. There's so many things we want to talk about to help you, to inform you so that we can change the system from the inside out. And let's do the takeaways.
All right. So you want me to start?
You start, yeah.
All right. So for me, there are 4 main areas that I always emphasize with a patient as things that we can do to take responsibility for our own health. There's a lot of research that has been done to show that if you really take care of these 4 areas, you are going to be in good shape. The first one is diet and nutrition, so making sure that you have good nutrition. Number 2 is moving your body and regular exercise. Number 3 is not only enough sleep, but good quality sleep. And number 4 is, we live in really stressful times. Most people, stress is one of the main causes of chronic illness, actually. And so learning how to deal with stress in a better way, through techniques like meditation, breath awareness, can really help support your overall health.
I love it. I'd actually heard that if meditation were a medication, the meditation medication, that it would be prescribed for everybody. It does so many positive things.
I agree.
And it's so simple, although it's so difficult as well. It's a lifetime of practice, but it's great. You should do it. But my takeaway is this is a little ninja thing that I've learned over the years. Over 48 years being in the system. That's crazy.
Wow.
I know. Is lists. Make a list. So the next time you have any kind of a doctor's appointment and you have those 10 to 12 minutes, although I heard there's like 6 minutes you have. But whatever it is, let's say you have as many as 12, make a list of questions. So if you have, let's say, 5 questions, things that you definitely want to ask your doctor about, write them down and go in there. And when you're sitting with him or her, say, okay, I have these 5 questions, and don't let the doctor leave before you ask all the questions. Very important. And tell them that. It's like, I just have these 5 questions or whatever it is. Make sure you get all of them answered, and then always end with, and if I have more questions, how best should I contact you? For my doctors, and I'm surprised that there are a lot. Like, if I want to email my doctors, that's just how I contact them with further questions. I have this little drop-down menu, and I can email specific doctors. And when I first hit the drop-down menu, I thought it was listing all the doctors that my health plan had. And it was just all the doctors that I had seen. I'm like, oh, wow. I've seen like however many dozens of doctors. But I can actually email them with further questions and look at your disease management, symptom management program, and see if you can email your doctor, because get those questions answered and ask questions like, hey, you know what? I'm going to go see a massage therapist. I'm going to go see an acupuncturist or a health coach or a hypno coach. And how best should I do that? Should I get a waiver? Should I get a release of information so the two of you can talk? That's the best way to change this thing from the inside out, is don't ask permission. Tell them that you're going to do this, or tell her that you're going to do this, and get a release of information. So there's this dialogue, and they're all included in the process so that you become in control of your health, not the symptom management program that you're involved in. That's my 2 cents.
I like it.
Anything else you got to add?
I think that's good.
Very good. So thanks for watching another show, and we'll see you next time, right?
Yes, indeed.
All right. Bye-bye.
Be well.